In other countries, this is a more known subject, and people are continuously doing anti-parasitic programs. And I've just been getting messages from different people from different places, and somebody's telling me that even in Africa, people are doing regular parasitic cleanses, and all over Europe. So, but in our country, it's still a mystery. So today we're demystifying some of the some of the aspects of this topic, parasites.
All right, so yes, I'm an Ayurvedic practitioner, but before that I was the registered nurse, and before that I was physician's assistant. I worked in different settings, began with the oncological surgery and then moved on to traumatology. Big deal of suffering people experience when they are terminally ill. And when I was studying for physician's assistant, of course, that was my initial education, going through the topic of parasites. Right then, it looked to me like that is a big problem. It's a major problem with health. It cannot be insignificant topic. We are all at risk, and we are not guaranteed not to get contaminated or avoid paying attention to that for whatever reason. I asked questions, but I saw that people, teachers, and then further on when I started to work, doctors, they were dismissive of this idea. Generally, not many people that would actually have multiple morbidities could be at the same time unexplained and not established for the causative factors. You know how the diagnosis formulated, they're just basically descriptive terms of the condition. They do not actually describe the causative factor. They're just describing the symptoms, even though those names are complex, and they're, of course, in Latin language. And how would we know what it means? We think that it means something. It's really a descriptive term of the root cause, but in fact, it's just the description of the symptomology. And what is the causative factor for inflammation? People now refer to inflammation as the causative factor, but where does the inflammation come from? Is inflammation the cause, or is it the effect? Yes, and it is the effect, it's not the cause. Then I saw that trend was such is that in the medical field that parasites were disregarded and not paid attention to, and that could be due to number one, they are very hard to diagnose. It's like pretty much impossible to diagnose a parasite with the first try. Not even some of the blood tests will show the parasites. They can only show parasites in certain cycles, or when the parasite is dying inside the body, they are leaching or secreting some of the protein of decay that can be indicative of the specific species of parasite, and that way antigens can show the presence of parasite. And just many doctors do not think of parasites as number one of the concern. They look for something else, trying to explain it by other factors. And generally, medical system look at parasitic invasion, which is the gross physical parasites that are infesting our digestive tract. Primarily, medical professionals think of parasites more like of the intestinal dwellers, the ones that just live in the intestine and affect the digestive tract. Majorly three types of parasites: protozoa, which we will also talk about, but it's not the helminth, it's not the worm, but the microorganism. And mostly we'll talk about the gross physical parasites, the helminths. That's what their name is, the helminths. Insects, maybe down the road we'll talk about those parasites and how they affect too, but mainly now we're concerned with the intestinal worms. The fact of that they're not so much considered and only considered within as the troublemakers in the digestive tract, I can tell right away that this is the major misconception. Intestinal parasites are not the intestinal parasites. They are the full body parasites. Now we have to understand that there's a lot of species of parasites, and only some of them can stay and live and multiply only in the digestive tract. And there is probably less amount of those. The rest of the parasites, they take the entire body, the entire system, organ systems and tissues for their home, and they spread and they multiply and grow within other tissues and organs other than the digestive tract. And this is one of the major mistakes that the medical professionals do when they don't consider other stages of development of the parasites. So there are three phases of the life cycle of the parasite. One is the egg stage. When female parasite sheds the eggs, they get out into external environment from the digestive tract, either through the rectum or with the vomit, which can also lead to reinfestation of the same person. First phase begins. So these eggs are in free flight in the external environment. They sediment in the ground, stick to the clothes, to the furniture. They're everywhere outside where there are animals generally, and especially the dirty areas. The eggs are all over. So what happens then? The egg needs to get inside the body of the intermediate host. And from that point, they will begin the phase number 2, which is the larva stage. The larva stage could be very dangerous. And in all 3 stages, I'd probably say 2 stages. In the larva stage and in the adult stage, these 2 stages need to be considered as 2 causative factors for 2 different types of conditions. The larva stage could also be very dangerous. So in the intermediate host, egg grows into larva, and usually those intermediate hosts are insects or fish or some small mammals, or even larger mammals could be intermediate hosts for different types of parasites. And then once that intermediate host is either eaten as the prey by another animal or the humans, some of the products like uncooked fish, uncooked meat, or poorly cooked meat, parasites can get inside our body, and the larva stage may actually also begin in our body, as well as the larva can grow into the adult worm. Larva stage happens within not specifically digestive tract, but the eggs have the ability of traveling inside into the blood circulation or lymphatic circulation, and then to any organ, any tissue, especially where there's like a good nutritious environment. Sometimes it may happen that egg can travel into lungs or the eyes or the brain, then develop into larva there, and that can cause different types of the conditions and symptomology. Parasites develop inside the organs, inside the tissues, and therefore the signs and symptoms would be indicative of those system and organs where the larva is being developed. Therefore, there could be a very different course of this symptomology, of this condition. Parasites can cause low manifested but stretch through time, weakness, sluggishness, anemia, of course, we'll get to that, in cough, irritability, some bad mental, emotional energies, and that can turn the form of the forever lasting, and it can just be a norm for some individual to feel that way and to live like that. They think that being sluggish is okay. So that can be the parasitic invasion actually working on the background, as well as the parasitic invasion may not even produce any signs for whatever time until the larva grows into the adult, if that happens. But some larvae can stay within the body for years, up to 20 years. Some of the larvae can dwell within the muscle tissue, within the lungs, and the host might not know about that they have this infestation. And again, the low rate of the condition that's happening at all times. And another thing, and very important, is that they may become more acute. The signs and symptoms may become very acute. They may even turn into the stroke-like symptoms, into the choking, allergic reactions, the edema, severe manifestations on the skin, and allergies, numbness in the limbs, things like that, paralysis. That's what it all may be fraught with. Well, let's say medical professionals, right? Well, because ultimately they are the ones that are responsible to be able to diagnose correctly. And as we see, a lot of undiagnosed conditions, and people are still getting some sort of treatment. They don't know exactly what's going on, and doctors, they don't really know of these manifestations, because many professionals consider only the intestinal phase of the parasite. So once the larva grows into adult size, then it travels from the lung, and that may actually go through an acute episode of the respiratory system. For example, there can be some bronchitis or pneumonia type of condition after which the person will feel better, but that was just basically the eruption of the capsule of the larva, and that actually crawled out and started making its way into the intestine, where it will now reside and multiply as the final location. So the point of the larva to travel into the organs and systems is because in the intestinal tract there's always movement, and there are always risks of being somehow affected by digestive juices or being just eliminated spontaneously. This is why the larva prefers to stay within the tissues and organs, within the other areas of the body. And believe me, some parasites we'll talk about, and we'll see how they make their way to a specific system. But if we take the broad spectrum of parasites, we'll understand that all of our body is affected by different sorts of parasites, possible parasites that can invade in the brain, into the muscle tissue, and into the kidneys, and everywhere you would even think impossible. But they make entire body their house. The professionals, they're always concerned with the intestinal parasites. They look for them there. They treat only the intestinal signs and symptoms. And once they're removed, they think that they're cleared and now the person is parasite free. But the cycle will continue, the larva will grow and then will hatch, and the adult will crawl into the intestine, reinfesting the individual within the next couple of weeks or so. So that is very possible, very likely, and this is how it will continue going. Now, why is only the intestinal phase that concerns the professionals? Because this is the only place where they can treat the parasite with their medications and chemicals. Otherwise, they are hardly treatable. The larva stage inside the organs and muscles, that is not even reachable by the medications. Now imagine once the parasite gets into the system, it corrupts the immune system. Up until that point, let's consider the immune system being intact, even though in our day and age, the immune system in most all individuals is not intact. And this is why the invasions happen, invasions of parasites and the viruses, bacteria, fungi, this whole hierarchy of parasites from the worms all the way to the viruses. And if the viruses are present, the chances that the worms are present as well. So because of this hierarchy, because they don't come one without the other. The immune system does not kill the parasites. There's no macrophage or the leukocyte that can actually work on the parasite and directly destroy the either larva or the grown adult, of course. So once the invasion of the egg happened through the digestive tract inside the and survived and developed into the larva, then from that point on, we will need by other supplemental means start getting rid of these parasites. There is no other way. And this is why whatever you do for parasites, especially if you're detoxing, raw foodist, I've heard many people say that, oh, I'm raw foodist, my immune system is already to the roof and my immune system can deal with this and kill them, but it's a misleading, it's the misconception, and raw food is actually in a higher risk group. So for the larva phase, the chemical medications, they are not effective. You cannot take them so much as to try to kill the larva inside the tissue. This is why it is not very much possible. And this is why professionals don't do that, because they don't operate on the level of the natural herbs and natural remedies, medicines. They put people at high risk of side effects, and those side effects for these very toxic medications pretty much severe. And nowadays I see there's some of those medications are being discontinued and banned because they pose the threat of triggering the oncological conditions, and the liver toxicity is so high that it destroys the liver so easy and quickly, even though sometimes on some medications, they may produce the liver enzymes in the plasma, and they say it's normal or the elevation is insignificant, but in reality, the damage is deeper than blood tests can actually show. Another thing with medical chemicals, they can only kill the parasites. That's what you usually do. And when even you read the annotation for the specific medication, it tells there that it actually kills the parasites. And we should not kill parasites inside our body. Main rule of parasitic detox is that we are not trying to kill parasites inside the body, because this is very fraught with peril, and that danger is of parasite being just stuck within the body and begin decomposing. The decomposition of the parasite inside the body will trigger the huge allergic reaction and will manifest through severe case of inflammation and intoxication with everything that comes out of it. And this is another particular reason not to use the medications. They do not deal with the larva in the other organs and systems. We definitely need to remember to support the liver. Liver is very important. We'll have the webinar such as this about the liver and its functions and the details of the liver physiology. Okay, so let's continue. I would like to share some slides right now. Okay, here is the beginning, and here we go. All right. So like I mentioned, there could be very foundational understanding should be that the parasites would have some common signs and symptoms and some common contamination pathways. The contamination pathways would be through the direct content, contaminated food, water, air. Sometimes the larva can actually fly in the air, the ground, the dust may be taken off with the jets of air, and people can get that inside their respiratory airways, inside their mouths, eyes, and especially little children, they're very much predisposed to this. In fact, little children are the highest group risk. We want our kids to grow healthy, and any parasitic invasion will affect their growth and development and may cause some irreversible changes and shorten the lifespan, depriving of the potential for the future. So it could be insect-borne transmission through mosquitoes, fleas, and ticks, with a direct contact with the animals, of course, and direct contact with the things that been contaminated with the eggs and larvae in the surrounding area, eating the food that is contaminated with the parasites. Those are basically the pathways of contamination. So generally think of it like parasites can penetrate pretty much through anything, even bite through the skin. Even when you think that there is like no reason for parasites to penetrate inside your system, there still can be some, like echinococcus, that can bite through the skin and get inside the body. But generally, the means are through the mouth. That's the main pathway. So that means that we need to really watch what we put in our mouth and usually keep our mouth closed. That's the best way in any situation in life, right? Probably. But generally, yes, that's a very big concern. We need to really pay attention to what we put in our mouth, not anything that we're not intend to eat, not our fingers, nail biting. That is a big danger and factor. Unwashed vegetable, unwashed fruit, that all carry the eggs and larvae. We really want to make sure that anything that goes inside our mouth is safe. Then the contamination may happen through the mucous membranes of our eyes, but that's least chance of that. So, but still possible. And like I said, even through the skin. So whatever measures we can do, the personal hygiene measures, early the external hygiene measures, as much as we can undertake, please, let's follow those guidelines, how we can prevent any accidents of contamination. Those pathways would actually mean that anything that comes in touch with some dirty soil, contaminated soil, may be a carrier of the parasites, larvae, and eggs. And this is why people who have the animals at home, pets, they are at higher risks for contamination and definitely need to be concerned with deworming their pets annually or even more frequently than that, especially considering that the cats and dogs may be free roaming and they're outside. They may be exposed to hunting some rodents and contact with other sources of contamination. And of course, when we eat animal products and fish products, especially if they're not well cooked, then we are at bigger risks. Everything else that you see here in this list is definitely puts you in a high risk of contaminating with the parasites. Swimming in open pools, lakes, stagnant lakes, especially in warm weather, even though parasites, they can live and survive like low temperatures too. Walking barefoot, a lot of people like doing that. That's a good thing to do. I love doing that myself, but there's some places that should just not be walked on barefoot, such as dirty city streets, for example, especially in the marketplaces, things like that. If other family members have parasites, we know that we would probably have parasites as well, and this is why the preventative measures need to be followed and the therapeutic measures need to also be followed in order to get rid of those infestations. Now, there could be some very distinctive signs for each parasite, but there are also general symptomology and signs for parasites in general. Usually, if we break it down to the cycles of their development, then the symptoms and signs would be pertinent to that specific stage of the parasite development. For example, in the larva that can grow inside the respiratory tract, we will have the weakness, long-lasting cough and phlegm production, some pussy phlegm, even the blood sputum could be present, difficulty breathing, shortness of breath, edematous appearance of facial edema that could be very common for many parasites, but those are very common symptoms for many conditions, not specific to the parasites, but other condition of the respiratory tract. If the larva gets into the neurological system and gets attached along the nerve fibers, there could be some paralysis or paresis, feeling numbness in certain areas of the body, poor motor function of the muscle, slow thinking, headaches, dizziness, vomiting, nausea. Those could be the signs of the larva stage in the neurological system in the brain. If the larva is developing inside the eyeball, then high percentage of the problems with the vision could be connected to the parasite invasion and need to be checked in order to establish the correct diagnosis and rule out the presence of parasites. And the intestinal phase of the parasite will definitely manifest through the GI conditions. It could be either cholecystitis or gastritis or pancreatitis. Other thing is that not only the larva stage goes in respiratory tract and neurological tract, but it also can be inside the liver and pancreas. Many parasites larvae would actually get inside the pancreas, causing the pancreatic cancer, pancreatitis, and poor enzymic production, the metabolic syndrome, diabetes, also effect of the parasitic invasion, which is going on in the pancreas. That's something many people just don't know and many doctors do not really recognize and pay attention to. The intestinal phase is accompanied by the GI symptoms, gastritis, discomfort, abdominal discomfort, distension. Distension is very indicative in the parasitic invasion, especially in some of the species of parasites. So those are the sites of the parasitic invasion as the fundamental basic for many parasites and their presence. So that can be indicators of the parasitic presence inside our body, especially if after trying to identify and establish the diagnosis, the doctors arrive at not understanding the causative factor and the condition is not really manifesting something that you don't recognize as a disease, but think that is a norm because you may be stressed out and things like that. But in fact, it is the parasite that's doing it. So general symptoms that can be indication of the parasitic invasions, especially if there are various intensity and various organs could be involved in it, then definitely we need to think of the parasites. All right, well, I also wanted to mention to say that there are a lot of species of parasites. Worldwide, there are about 300,000. There's 70 of the invasive species of parasites that are posing threat to the human. And we probably need to know about 15 to 20 types of the major parasites that we need to know in order to recognize the signs and symptoms and understand that we have the invasion and then to deal with it timely and effectively. The symptoms, again, I just try to cover most of them, but there could be different other symptoms, especially in GI tract. There could be the deficiency with the microbiome. It could be the dyskinesia of the liver ducts and pancreatic ducts, which blocks the bile flow, and the person may appear like they're having hepatitis, having jaundice, having some poor digestion and distension, bloating inside the intestinal tract, being very irritable, angry at the same time, depressed on the other hand, very agitated people. In fact, some of the parasites, they even secrete the neurotransmitters that affect our nervous system and make us being very active and active in society. And some of the distinguished figures in the mankind history could have had parasites as well, like Hitler, for example. Parasites will produce their very particular symptoms for each species. And here we kind of begin. So it was the introduction. Now let's talk more closely about what it is very essential to know in order for us to recognize these things quickly and take measures accordingly without delaying and without giving a chance developing into something terrible. So, things to know about parasites, even though it's a very broad topic, but we wanted to bring it down and compress it to something that quickly can be digested by our understanding and can be well structured and be practical. So there are three types of the helminths, the intestinal parasites. The main ones that we need to know now. These three that poses the immediate threat and the major threat to our health, and those are the roundworms, the tapeworms, and the flukes. So there are three helminths. The roundworms, they're also called nematodes. There's a lot of species within this type, and we will talk about the pinworms. Those are the major concerns for the United States territories. So those are pinworms, the ascaris, the hookworms, and the worms, Toxocara as well. Then the tapeworms, the cestodes. The cestodes, they are big, few species within this type that are very small and tiny worms, but mainly they're very broad and wide. They're like ribbons with a tiny head on their tip. Those are the tapeworms. They are actually the encapsulation masters. They are the ones that like to form the capsule, and that capsule can survive harsh conditions and dwell within the tissues of the intermediate host for a long, long time. And those are very well-known fish tapeworm, broad tapeworm in other sources, and then pork tapeworm, beef tapeworm, dwarf tapeworm. And then also a big concern is the Echinococcus, and that type of the parasite is a tiny one, and it happens it multiplies to huge numbers and can pose like a very immediate, acute type of condition. Flukes, trematodes, lung fluke and liver fluke, they are the most famous ones, or infamous, I know which term is better, but mostly known flukes, and they're flatworms. They're basically related to tapeworms too, because tapeworms, I think, are flatworms too, so they're kind of related, but they're in different genus, I think, and they basically just flat like leaves, or maybe a little thicker, but still, and they suck the blood, and most of them, they do not live in the lumen of our intestine. They can live in the gastrointestinal tract, yes, especially liver, pancreas. That's what they love. A lot of people think when we talk about intestinal parasites that they all just live inside of the lumen of the intestine, somewhere in the large intestine or in the small intestine. But in fact, there's a small percentage of the parasites that live specifically there. And they do that during their adult phase, which is the intestinal phase only. So imagine what a small percent of the parasites actually appear to be inside the intestines. Most of them, they live in other places of the body, especially those flukes that are blood-sucking. They prefer to live inside the organ, especially the liver fluke. It actually feeds on liver cells. And no matter whether you want to detox, and that will not help. And many, like I was mentioning before, raw foodists, they think that their immunity is so high that they can annihilate any parasites. They're very wrong about that, because parasites, they will suck your blood all the way to the end, and it doesn't matter whether you're fasting, you're cleansing, or whatever your nutrition is, they will just feed on the blood, and that's all they need. Our immune system will not be able to fight that parasite, and therefore parasites will live in the body all the way until they can. Blood-sucking parasites will suck a lot of blood out, depriving the host of the nutrients, iron, of the hemoglobin. The anemia is the result of those parasites. The B12 deficiency is the result of the parasitic invasion. The tapeworms, they can actually absorb all the nutrients, up to 80% of nutrients and vitamins. So imagine everything that you may eat, only 20% of nutrients will actually be yours. The rest will go on to feeding the tapeworms or other parasites in the body. And what could be the result? It's very sad, but the nutrient deficiency and the conditions, the poor immunity, the opportunistic infections, and especially in those blood-sucking parasites, they do the bite, the multiple bites inside the intestinal tract, inside the other organs, predisposing to the bleeding, internal bleeding, to the opportunistic infection getting in those wounds and starting the inflammation process and the pus formation process that can eventually lead to the oncological conditions, as well as encapsulated larvae in other sites in the tissues of the body that can also cause the malignancy and turn into the tumor, because when the capsule erupts and the parasite crawls out, some of the tissues are already damaged there, and they already have some decomposing process initiated within that tissue that actually can continue to mutate into the oncological condition. If people see the anemia, that can easily relate to parasite invasion. In fact, that could actually be one of the major causes, because there could be no reason for the person not to be sufficient with the iron if they have the balanced nutrition, other than something stealing the nutrients from the individual inside. And definitely our skin shows signs of parasite. So any dermatitis, neurodermatitis, so any skin condition can also be considered as the parasitic invasion. Any fungal infection that is long-standing and present in the body, does not respond to any treatment, could also be the comorbidity of the parasitic invasion, need to be addressed at the root cause, and that is the parasite. And the asthmatic manifestations, the pulmonary and respiratory manifestations, can also be connected to that. So if you go to see a doctor with any of those conditions, the anemia, the dermatitis, or the respiratory condition, and they don't check you for the parasites, I would say, don't trust that professional any further. This is the extent of this concern. So let's go on. And here are some of the areas where the parasites invade. This is where they live and bring us harm. Echinococcus and Trichinella, they are the roundworm and tapeworm. They like the living in the bottom of the eye because it's very rich beta carotene, and this is one of the major nutrients. They crawl from the lung and through the nasopharyngeal cavity and through the ear canal. They can easily crawl into the eye or into the brain, anchor there, and start developing from the egg into larva. Encapsulation stage, they can begin developing into the adult specimen, which then will crawl out, bringing the very acute phase in the health of the host. It will feel like experiencing a stroke, a huge, terrible headache, and then all of a sudden everything subsides. The person recuperates quickly, but of course some of the symptoms will linger, but at a lower rate, and the parasite crawls down to the final destination, which is very likely either the liver or the small and large intestine or the respiratory tree. Pork tapeworm cyst will also form inside the brain. The ascari, which is the roundworm, the taxocara, which is also the roundworm, they're very closely related. Taxocara is the same as ascari, basically, and has a little different pathogenesis and size, but maybe they do the same thing, both bloodsuck, and they can basically swim inside our body. They can ascend the bloodstream, crawling up the venous circulation, lymphatic circulation. The infestation can be huge and terrible. There could be like eggs populating the lymphatic system. and lymphatic nodes, but they prefer living, crawling into the respiratory system. Trichinella likes the muscle. We'll talk about that. This is one of the most dangerous parasitic species. It develops inside the strident muscle groups, which is the chewing muscle, diaphragm, and heart muscle even. So the heart muscle is predisposed to parasitic invasion with the formation of the cysts and capsules. And those capsules, once they start forming, they can only be treated to a certain period of time, but then they can actually harden. The shell is pretty tough. That shell actually can calcify. And once the shell of the larva calcifies within the tissue, there is no way of extracting it other than the surgical means. There are a lot of parasites that are aiming at the liver, Apistorchi, Echinococcus, and they just eat the liver because this is the nutrient treasure chest. And the pinworms, we'll begin with the pinworms. They prefer to live in the large intestine, the small intestine. There's like least amount of species that crawl out of the rectum during night. The pinworm is one of them, and only female does that when it sheds the eggs and then crawls back in. Other worms do not crawl any close to the rectum, and this connected with the fact that there is like least amount of nutrients there. The nutrients are mainly inside of the large intestine and the small intestine. This is actually the best place where the nutrients are after our digestion. They're broken to the needed consistency, and this is where parasites can easily feed on the nutrients that we've kind of pre-digested for them.